One of the most important revelations in aging science over the past few decades is the recognition that chronic, low-grade inflammation, often silent and invisible, plays a central role in driving the aging process. This insidious form of inflammation, now often referred to as inflammaging, slowly erodes tissues, accelerates cellular damage, and increases the risk of nearly every major age-related disease, from cardiovascular decline and cancer to neurodegeneration and metabolic dysfunction. At the heart of this inflammatory cascade is a delicate balance between immune surveillance and immune overactivation. And standing out as one of the few nutrients with the power to gently yet significantly shift this balance toward health is vitamin D. Inflammation is not inherently bad. In fact, acute inflammation is an essential biological response that protects the body from infections, repairs damaged tissues, and coordinates healing. However, when the inflammatory response becomes chronic, even at low levels, it begins to act like a slow-acting poison. Inflammatory molecules, particularly cytokines like interleukin-6, IL-6, tumor necrosis factor alpha, TNF-A, and C-reactive protein, CRP, start to circulate persistently in the bloodstream. This leads to subtle but steady damage to DNA, mitochondria, and cell membranes. Over time, this damage triggers cellular senescence, shortens telomeres, and weakens the body's resilience to stress and disease. What makes inflammaging especially dangerous is that it is often invisible. Unlike a fever or swelling that signals acute inflammation, chronic inflammation often produces no immediate symptoms. Yet inside the body, cells are under pressure, tissues are struggling to repair, and the immune system is burning through its resources inefficiently. As a result, older adults with elevated markers of inflammation tend to age faster biologically, show greater cognitive decline, and face higher risks of frailty and chronic disease, even if they appear healthy on the surface. This is where vitamin D emerges as a unique player. Though commonly known for its role in bone health and calcium metabolism, vitamin D is increasingly recognized as a potent modulator of the immune system. Unlike pharmaceutical anti-inflammatories, which often work by forcibly blocking specific inflammatory pathways, vitamin D takes a regulatory approach. It gently rebalances immune function, promoting anti-inflammatory pathways while damping down excessive immune responses that lead to chronic inflammation. At the molecular level, vitamin D operates through the vitamin D receptor, VDR, which is expressed in most immune cells, including T cells, B cells, macrophages, and dendritic cells. When activated by vitamin D, this receptor alters the expression of hundreds of genes involved in immune signaling. For example, vitamin D helps shift the balance from pro-inflammatory Th1 and Th17 cells toward more regulatory T cells, Tregs, which help maintain immune tolerance and suppress overactivity. It also inhibits the production of IL-6 and TNF-A, both of which are tightly associated with aging, frailty, and chronic disease. Clinical studies have repeatedly shown that higher blood levels of 25-hydroxyvitamin D are associated with lower levels of inflammatory biomarkers. In both healthy adults and those with chronic conditions, supplementation with vitamin D, especially in doses of 1,000 to 2,000 IU per day, has been linked to reductions in CRP and other pro-inflammatory cytokines. While results can vary depending on individual baseline levels and health status, the trend is clear. Vitamin D helps cool the chronic fire that underlies many aspects of biological aging. One particularly compelling aspect of vitamin D's anti-inflammatory role is its potential to protect telomeres, the protective caps at the ends of chromosomes. Inflammation accelerates telomere shortening by generating oxidative stress and damaging the enzymes that maintain telomere length, such as telomerase. By reducing inflammation and oxidative stress, vitamin D indirectly supports telomere maintenance. Several population studies have found that individuals with sufficient vitamin D levels tend to have longer telomeres, a sign of slower biological aging. Moreover, the anti-inflammatory effect of vitamin D appears to benefit multiple organ systems. In the brain, reducing inflammatory cytokines may help preserve neuronal plasticity and reduce the risk of cognitive decline. In the cardiovascular system, lower inflammation means less damage to arterial linings, leading to lower blood pressure and reduced plaque formation. In the gut, Vitamin D enhances the integrity of the intestinal barrier, reducing leaky gut and the immune activation that often follows. This widespread impact reinforces the idea that inflammation is not just one problem among many in aging. It is a common root from which many health issues grow. What's especially promising is that vitamin D is safe, accessible, and inexpensive. A daily intake of 1,000 to 2,000 IU of vitamin D3 is enough to raise serum levels in most people to a range where anti-inflammatory effects become more pronounced. Unlike some pharmaceutical interventions, vitamin D carries a low risk of side effects when taken within this dosage range and is effective even when started later in life. For those living in northern latitudes, spending little time outdoors, or dealing with chronic stress or illness, supplementation becomes not just useful, but essential. Of course, vitamin D alone is not a silver bullet. Inflammation is influenced by many factors: diet, sleep, exercise, stress, exposure to toxins, and other micronutrient levels. However, vitamin D acts as a cornerstone nutrient that influences how the body interprets and responds to these stressors. It is a modulator, a buffer, and a quiet guardian against the tide of chronic inflammation. By keeping the immune system balanced and inflammation in check, vitamin D supports a biological environment where healthy aging can occur. In conclusion, the link between inflammation and aging is now indisputable. Chronic inflammation accelerates the decline of virtually every major tissue system in the body, and its presence is a hallmark of accelerated biological aging. Vitamin D, through its gentle and comprehensive immune-regulating properties, offers a simple but powerful intervention to counter this process. As the science continues to evolve, it's becoming increasingly clear that maintaining adequate vitamin D status isn't just about preventing bone fractures. It's about preserving the body's youthful capacity to regenerate, resist stress, and age with strength and clarity. For anyone seeking to age well and preserve their health into the later decades of life, controlling inflammation is essential, and vitamin D is one of the most evidence-based, accessible tools to help do just that.